Nursing 345, Peripheral Vascular System and Lymphatic System. The objectives for this week are to summarize the mechanics of respiration, identify the location and functions of the trachea and bronchial tree, describe the characteristics of heart sounds, cite the risk factors associated with heart disease and stroke, list the pulses that are accessible to examination, and cite the location of superficial groups of lymph nodes that are accessible to examination. For the heart and neck vessel content and thorax and lung content, please complete your shadow health concept labs. Also, you need to check out your Jarvis textbook student resources for assessment videos. So I just wanted to provide a checklist for heart and neck vessels examination. So for the neck, you would observe and palpate the carotid pulse, observe jugular venous pressure or pulse, estimate jugular venous pressure. For the precordium, you would inspect and palpate. You need to describe the location of the apical pulse and note any heave or thrill. When you listen, you need to identify the anatomic areas, noting rate and rhythm. Listen for murmurs, repeat with bell, and listen at apex and base. So you need to listen with both parts of your stethoscope. For the thorax and lungs, for that examination, the checklist includes inspection, which you would inspect the thoracic cage, respiration, skin color and condition, person's facial expression and level of consciousness. As far as palpation, you would confirm symmetric expansion and tactile fremitus. You would detect any lumps, masses, or tenderness. For percussion, you would percuss the lung fields and estimate diaphragmatic excursion. And when you listen, you would assess the breath sounds and note any abnormal or adventitious breath sounds. And there are other tests that you may need to do if they are required. For the vascular system and lymphatics, the vascular system consists of the vessels of the body which transport fluids such as blood or lymph. Any disease in the vascular system impairs the delivery of oxygen and nutrients to the tissue and retards the elimination of carbon dioxide and waste products from cellular metabolism. Arteries, as you know, carry blood from the heart. They are strong, tough, tense vessels designed to withstand the pressure created with each heartbeat. Arteries contain elastic fibers that allows their walls to stretch with systole and recoil with diastole. Veins drain deoxygenated blood and waste products from the tissues and return blood to the heart. They are thinner and more passive than arteries. Veins contain intraluminal valves. There's 3 mechanisms that keep blood moving toward the heart in the venous system. First, blood moves from low pressure system of the veins through the contraction of skeletal muscles that milk the blood back toward the heart. Second, blood moves because of the pressure gradient caused by breathing. Third, blood moves because intraluminal valves keep it flowing in one direction. Risk factors for venous stasis include standing, sitting, or bed rest because of the absence of the milking action of walking. Other risk factors are hypocoagulation, vein wall trauma, varicose veins, obesity, pregnancy, and genetic predisposition. The lymphatic system is a separate system that retrieves excess fluid and plasma proteins from the interstitial spaces and returns it to the bloodstream. The lymphatic system has 3 major functions. First, it conserves fluid and plasma proteins that leak out of capillaries. Second, it is a major part of the immune system that defends the body against disease. Third, it absorbs lipids from the intestinal tract. Lymph nodes are the small oval clumps of lymphatic tissue located at intervals along the vessels that filter fluid before it is returned to the bloodstream and remove harmful organisms. Within the lymph nodes, pathogens are exposed to lymphocytes, which mount an antigen-specific response to eliminate the pathogens. With local inflammation, the nodes in the affected area become swollen and tender. The spleen, tonsils, and the thymus aid the lymphatic system. The spleen, in the left upper quadrant of the abdomen, destroys old blood cells and produces antibodies and stores red blood cells and lastly filters organisms from the blood. The palatine adenoid, and lingual tonsils are located at the entrance to the respiratory and gastrointestinal tracts. They respond to local inflammation. The thymus, located behind the sternum and the mediastinum, develops T lymphocytes in the immune system in children, but atrophies after puberty. Subjective assessments of the peripheral vascular system and lymphatic system includes asking about leg pain or cramps, skin changes on arms or legs, swelling or lymph node enlargement, medications, and smoking history. Objective assessments, you would first assess the arms, noting the skin color, temperature, texture, and turgor. Assess for edema or clubbing, capillary refill, and radial and brachial pulses. Next, assess the legs, noting color, hair distribution, venous pattern, and size. Palpate the temperature of the feet and legs, the inguinal nodes, and the femoral, popliteal, posterior tibial, and dorsalis pedis pulses. Expect findings to vary among patients in different developmental stages. For example, in healthy infants and children, lymph nodes commonly are palpable. Pulse force should be normal and symmetric in both upper and lower extremities. Palpable lymph nodes occur often in healthy infants and children. They are small, firm, mobile, and non-tender. Vaccinations can produce local lymphadenopathy. Note characteristics of any palpable lymph nodes and whether they are local or generalized. In pregnant women, diffuse bilateral pitting edema and varicose veins may appear in the legs. Expect diffuse bilateral pitting edema in the lower extremities, especially at the end of the day into the third trimester. Nearly 80% of pregnant women have some peripheral edema. Varicose veins are often seen in the third trimester. In aging adults, the dorsalis pedis and the posterior tibial pulses may be difficult to find, and trophic changes are likely to be present. You may find thin, shiny skin, thick, ridged nails, and loss of hair on the lower legs. As far as culture and genetics, the American Heart Association considers peripheral arterial disease and coronary arterial disease risk equivalent, thus screening and treatment are essential. Peripheral arterial disease is associated with several genes interacting with themselves as well as the environment. So, smoking is the strongest risk factor associated with peripheral arterial disease. Peripheral arterial disease disproportionately affects Blacks, and the ethnic group with the highest peripheral arterial disease risk factors are non-Hispanic Blacks. Ankle brachial index is a non-invasive screening tool for PAD. The American Heart Association recommends screening for all people over age 70 and or who are between ages 50 and 69 who have a history of smoking or diabetes. Make sure you incorporate health promotion when assessing the peripheral vascular system. For instance, discuss ways to prevent foot problems and more serious disorders. Teach the patient the principles of good foot care, such as checking the feet every day, keeping the blood flowing to the feet, wearing shoes that are fit comfortably, and keeping the skin smooth and soft. This last slide is just some sample notes that you can see include subjective and objective data.